I want to discuss CMS Area Wage Index. I've had so many people come into my office to discuss this. I had 2 different groups today. It is destabilizing hospitals and rural health care. AWI disadvantages rural hospitals because they're locking them into a system that suppresses reimbursement and limits their ability to recruit and retain medical staff and specialists. And as you know, during Trump's first administration, policy was implemented that helped raise Medicare payments for hospitals in that lower quartile. This policy was huge for rural health care, but the court-ordered demise of that policy has led to financial distress and recruitment challenges when they're trying to recruit doctors to Mississippi and they can get so much more for the exact same procedure in other states. This is not a one-time gap. It compounds every year. Hospitals like Forest General, a level 2 trauma center in Hattiesburg, Mississippi, are expected to deliver complex, specialist-driven care, but they're reimbursed as if costs are low, absorbing an $8 million annual loss due to this disparity. And obviously that gap is just unsustainable. If this continues, it won't just affect one hospital, it will weaken the entire 19-county rural network, roughly serving 700,000 Mississippians. Without immediate changes to AWI methodology to create a more level playing field, rural hospitals will face an unsustainable future, and obviously it's the patients that are going to suffer. Mr. Secretary, would it be fair to say that the current area wage index creates a compounding disadvantage for hospitals in persistently low wages states like Mississippi? And how willing is the administration to work with Congress to provide the necessary direction and funding to appropriately evaluate near-term adjustments in order to provide this much-needed relief to states that are persistently low AWIs?
The wage area index is destroying rural areas in this country, and we know it's a problem. As you know, under the Social Security Act, any changes we make in it have to be budget neutral. So if you give more to one area, you have to take from another, and the political blowback, even if we could do it, the political blowback is very loud. Let me say this. The change has to come from Congress, and we want to work with you to make changes that we think make sense, which means getting more money to rural areas.
Thank you, and I think that we just wanted to verify because it will have to come from Congress, but thank you for your willingness and your commitment to work with us to get there.